Hi, my name is Samantha Castillo, and the question that I chose for my presentation was to choose a social determinant of health and determine its health outcomes. So I have chosen neighborhood and built environment as my social determinant, and I will be talking about its impact on health outcomes. So, what are social determinants of health? So, the definition, according to Healthy People 2030, is that these are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So, there are 5 social determinants of health. These include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, which is what we will be talking about today, and social and community context. So let's talk about neighborhood and built environment. What does this include? This includes access to foods that support healthy eating patterns, quality of housing, crime and violence, environmental conditions, and access to transportation. This can include more, but these are just some of the ones that I'm choosing to talk about today. In my opinion, they are the most important and the ones and the factors that influence this social determinant the most. So, one of the first impacts on health outcomes that we will talk about is the access to healthy foods. So, accessibility to grocery stores that sell affordable fruits and vegetables can lead to healthier eating patterns, which then leads to a lower risk for chronic disease. Healthy eating is a form of primary prevention because it is an action taken to avoid the onset of health problems. And food deserts are areas in a neighborhood where there really is not a lot of access to healthy and affordable dining or grocery stores. And instead, there's a lot of fast food dining, a lot of drive-throughs, a lot of stores that don't sell fresh fruits and vegetables, or if they do, they are very expensive and just not very accessible to the majority of the population. So, food deserts do promote unhealthy diets, and they are mostly located in areas with ethnic minority and low income populations with higher rates of obesity, type 2 diabetes, cardiovascular disease, and other diet related conditions. Okay, the next factor that impacts the health outcomes, um, there is air quality and poor ventilation. So we're going to be talking about the quality of housing. Okay, so air quality and poor ventilation, dirty carpets, pest infestation, these can all lead to mold, mites, and other allergens associated with poor respiratory health. Cold conditions in a home may raise blood pressure and increase risk of cardiovascular disease. They may also raise the risk of heart attacks, which is related to cardiovascular disease. And also unsafe housing conditions such as crowded spaces and too many residents in one space can lead to physical injuries and higher contamination risk. If one member of the household falls sick, this can make it a lot easier for other people in that household to also become sick because if there's a smaller space, there's less room to isolate. Okay, and then the next factor that impacts health outcomes for this social determinant of health is crime and violence. So it has been found that crime and violence in a neighborhood and built environment increases incidences of depression, anxiety, post-traumatic stress disorder, suicide, cardiovascular disease, premature mortality, and substance abuse disorder. The different types of violence and abuse includes child abuse, both physical and sexual, domestic violence, intimate partner violence, elder abuse, sexual violence, bullying, and interpersonal violence. Okay, and then the next factor is environmental conditions. So this includes water and air pollution. Water and air pollution increases the risk of respiratory infections, heart disease, and cancer. Extreme weather, this includes extreme heat and extreme cold. So extreme heat can cause heat-related illnesses, and extreme cold can increase the spread of viruses and also increase risk of cardiovascular disease. Extreme weather can also cause power outages that may lead to carbon monoxide poisoning. And then access to transportation. So this is a big one because transportation barriers can lead to missed or delayed appointments and medication access. Without steady and reliable transportation, there can be a delay in clinical interventions, resulting in lack of appropriate medical treatment or unmet healthcare needs. So if someone doesn't have reliable transportation to get to their prescription refills or checkups, this can really set their health back because then they're not able to actually get the care that they need in a timely manner. So this is an example of the importance to have access to transportation when it's related to healthcare. So in this class, we read the story about the woman in the mirror. And this was about a homeless woman who was picked up from a convenience store after complaining about chest pain. She was very uncooperative and difficult, and later the paramedics discovered that she had previously been discharged with a coronary artery stent. And the paramedics then questioned her why she didn't follow up with her medication since it was free. And she said that she had no money, but then they questioned because the medication was free. But then she later admitted that she had no money for the bus to actually get to the pharmacy and pick up her medication. So this example really shows the importance of access to transportation and receiving timely medical care, because in this case, the woman just ended up being admitted again to the hospital, this time for a longer period of time and for a much more extensive treatment. So all in all, a person's neighborhood and built environment plays a crucial role in their health outcomes because the contributing factors increase risk of chronic disease, mental illness, cardiovascular disease, physical injury, and access to medical care and healthcare needs. These are my references. And that concludes my presentation. Thank you.